All right. Good afternoon, everyone. My name is Matt Fessler. I'm the Associate Dean of Enrollment here at Hudson County Community College. And I would like to welcome you to our virtual info session today, which is on the Medical Assisting Program at HCCC. Once again, thank you all for joining us today. So I am actually not your main presenter today. I'm more of a host. I will have our presenter join us in just 1 second. But I do want to let you know that today during the presentation, you can ask questions, and this is live. So there's a Q&A chat box on the right-hand side that you should be able to put questions in. At the end of the presentation, we will be going through those questions live in person here at the end of the event. So if you have any questions, you can start putting them in now. You can start putting them in during the presentation, or you can wait to the very end, and I will host that Q&A session at the end. I'm also going to join at the end and go over some just basic enrollment information, and I also will share a promo code to waive the $25 application fee at Hudson County Community College. So with that being said, I would like our presenter, who is an instructor of the program, turn on her microphone and camera and join us at this time. And I am going to give her the opportunity to introduce herself, and then she will be going through the main part of the presentation.
Hi, thank you, Matthew. Thank you for hosting this event for us and giving me the opportunity to share some highlights about the medical assisting program in Hudson County Community College. And thank you all for taking the time to join us through this event, through this information session. And I'd be more than happy to share with you some points about the program, about the college, our college, and how to get there, how to achieve your dream or being medical assistant. So my name is Dr. Jihan Nakhla. I am the medical assistant instructor in the nursing and health sciences division, and I will be joining with you during this session in order to let everything to be clear and answer your questions. And we are all here for you. Well, let's get started. And as Matt said, at the end, we will be more than happy to go over your questions, answer them live, and whatever you need, we will try our best to satisfy. Well, to start with, I want to give you an idea that at Hudson, that you will gain some knowledge and experience in the art and science of medical assisting, and in the preparation and education that you will receive here at the college. It will help to prepare you in order to become a successful member of the medical assistant profession. Listen, we are all here, faculty and staff, eager and willing to work with you in order to encourage your personal and professional growth. Next, please, Matt. So now the most important thing, why medical assisting? Why Hudson? And why now? So let me share with you some points in order to understand, is it a good choice to think about medical assisting now? Okay, so I think we are all familiar with that the role of the medical assistant has evolved. So medical assistant now is not just checking the pulse temperature and prepare the patient to be examined by the physician. Moreover, right now you'll be able to assist in the EHR. If you don't know, so what is EHR? EHR, it stands for the electronic health record. So you are able right now to assist in uploading the medical record of the patient on the software computer system, which is very good. And it's good to mention here that now in Hudson, we are providing our students and offering them the chance to practice on the MOSS, which is the medical office software simulation. This is very good chance to practice in order to know how to schedule appointments, for instance, to post the payments of the patient, to do on the billing and coding, to upload all the records of the patients. So once you're done and graduated, whenever you put this on your resume, it will look good on your resume. And whenever you try to apply to medical assistant job, yes, it will be very easily picked up. Well, what else? So you as medical assistant in here, you can shine now. What does it mean? So I feel like that you are the human element in the patient experience in the doctor's office. Uh, Whenever we go to a doctor office, who is the first person that you will see? Medical assistant. They will greet you, and the medical assistant will answer the phone call. So you are the human element. That's why you need to build up some communication skills, which we refer as soft skills. And in here, we're in Hudson, you will have a very good chance in order to build up these communication skills to be successful medical assistant. All right, let's go next. So we say that the medical assistants are versatile. What do you mean by that? So you will see that you have administrative duties and clinical duties. So administrative duties, they are at the front. So they are receiving patients, greeting them, help them to check in. Also, they will answer the phone call, schedule their appointments. Moreover, you are able to check their insurance and let them to know what are the benefits they do have under their plans. Also, you'll be able to file the CMS form, which is the insurance claim form, that based on which the physician will be reimbursed. Also, you will be able to file the medical records for the patients, and you will be assisting in the billing and the bookkeeping. All of these to be done at the front. If you go in the back, so what do you mean by the back? The back, it means that preparing or working with patients in the examination room. So would you go next, please? Next slide. So the clinical duties, you will see here, you will be the person who's checking the vitals, the pulse, the temperature, the blood pressure, the weight and height. Also, you'll be able to perform simple procedures in the form of EKG. And EKG, you will be practiced a lot. So we have clinical labs. They are equipped with very high devices, machines, and the EKG machine that we have in here is very good. You will be able to do the EKGs, to know what's normal, what's abnormal, and to know how to avoid the errors and how to present it in a good shape. Also, you will be able to do some throat swabs to be sent for culture. You will be able to do some urine examination. You'll be able to do the check the blood sugar for diabetic person. So you can check for pregnancy test, all of these. And you are able to see that you will be able to draw blood. Do you know that? So in here in Hassan, you will be practicing on how to draw blood. And in order to do it in your real job, you will need to be a certified. Well, let me add one more thing about the medical assisting profession. So the medical assistant profession can be considered as a standalone career. What does it mean? Some students, they are satisfied with being medical assistant, they having very good job, they are earning good amount of money, and at the meantime, they will be able to take care of their family members. Others, they think about it a different way. So they think, okay, I want to go, I'm looking forward to a different step or a further step. So we can consider the medical assisting as a stepping stone into a different medical career. So I have many of my students, they are thinking to join the nursing program once all of their circumstances are working well. So, okay, let me go. Now I'll be medical assistant. I will have a job, and now I can study further in order to be a nurse or physician assistant and all of that. So this is very good point about the medical assistant. Also, can we go next, please? We cannot forget or ignore the impact of this pandemic, COVID-19, on the healthcare industry. And we all see that it has brought up the new attention to the healthcare professional, the role of healthcare professionals. And you can see that there is increasing demand to these frontline professionals nowadays. And this increase, it will continue for a while. So we can say that we are at the start of a new decade of a enormous growth of healthcare industry. And if we just look with me at this graph, what do you see in here? So it will represent, this is the medical assistant job increase between 2018 to 2028. And this is based on the US Bureau of Labor Statistics and Employment Projection Program. So you're able to see that 23% in comparison to the other occupations. Is it a good number? It is a good number. So it means that this is a promising career for now, and you'll be able to get in easily, as we will see. For all of these reasons, I can see that medical assistant is a good and smart idea to start thinking of right now. Well, let's come to the next step. How long does it take to become a medical assistant? Do I have to study forever to start working? Of course not. So if we go to the next slide, you will see that the medical assistant profession is 24 months. It is clinical competency-based educational program. So, oh my God, 24 months? Okay, wait, it's just 4 semesters. So you need to spend 4 semesters in order to be a medical assistant. It's not that much. And it's clinical competency based. So it means that you have hands-on a lot in order to be well skilled. And we all know that you are working. So I know that most of my students, they are working. You have your work schedule, either full-time or part-time, or maybe you have family obligations. That's why we are doing our best to offer some of the classes in the morning, others in the evening, and others online. So you can mix and match in order to set up your schedule. And in here, I highly recommend that any one of you, please come and see any of us in the department. So we will be able to assist you how to set up your schedule. Why? Not to waste your time, not to waste your money. So you have a goal and you want to go straight to that goal in order to achieve your dream by becoming medical assistant. Well, what about the class size? When I say 25 students, I want to highlight something. I want to say that you have good opportunity to listen, to absorb the material, to ask your instructor about different questions, to interact with your classmate. So we have a lot of group discussion, and also during the clinical labs, you will have a very good chance, a very good time in order to practice. So you feel confident about what you're doing. Well, next, Matt, thank you. After you're done, when you're successfully completing your program, the students will spend like 200 hours in externship in any of the clinical sites. One of commonly asked question, can I go anywhere to any of the clinical offices to spend my externship? Let me tell you. So in here in Hudson, we have a very good network. So we have contract with several clinical sites. Most of them, they are medical centers. So you will be exposed to different specialties. So you will be able to learn more, to practice more, to gain more experience, and it will look better to your resume. Well, after graduation, our graduates, they are eligible to sit for the CCMA exam. That stands for the Certified Clinical Medical Assistant exam. What's that? This is certification exam offered by the NHA. Now let me share with you. Is it important to be certified medical assistant? To be honest, a couple of years ago, it wasn't that important that much, but now it's vital. So once you're done, you'll be able to see that the employers, they like to hire those certified medical assistant more. And it's good to be a certified one. Once you are done with your externship, you will be hired easily. And I'm not lying. So most of my students, we can say like 90 to 95% of our students, they are hired right away after they are done in their with their externship. They are hired in the same clinical sites that they are taking their externship in. So if I say within 6 months, no, it could be less. So once you're done and you are certified, you will be picked up. All right. Okay, that's good. But how to start? Is it complicated? Of course not. So if we come to the next slide, you will be able to see we have some admission criteria. Is it too much? I don't think so. So let's start in here. Once you decide, you just need to fill up the application to be enrolled as Hudson student. And then you need to show the high school diploma or GED, and you need to take the college placement test. And right now it's offered online and remotely, so you can take these tests, and once you're done, you're good to go. So where to go? It will be the next slide. We have like the courses of the medical assistant. They are divided into two main categories. I have some of them under general education requirements, and the next group, it will be for the major courses. So if you look with me here, medical assistant, it is associate in allied science. And you will be able to see we have different courses. Are they a lot? So no, they are very easy. So this is the first one, college student success, CSS 100. And I have in here some English courses like in English Comp 1 or 101, 102 or 103. Do we need these courses? Of course you do. Why? Because whenever you are trying to write a report or stuff like that, it's good to have very good English. Also in here, you have introduction to computer and computing, and you will need that so bad. So you will need it a lot because you are working mainly on the computer. You have here culture and values, AMP 1 and 2. So all of these courses, you need to finish all of them before starting the major courses. Why? Let me tell you, because they are like a foundation. So instead of struggling while you're taking the major courses material, no, now you have everything clear and you will go ahead to take your courses. Once you're done with these courses, and before we start the major courses, every student, you need to have your primary doctor to complete the physical form and to show the proof of the health insurance. Why? Remember, our concern is your safety. So we want to make sure that every student, they are safe enough, and you have all of your immunization record and everything perfect before you start, because you'll be exposed to each other doing EKGs, drawing blood, all of that. So we want to make sure that everybody is safe and sound. Then we will come in the next slide here, in this slide. So it will be the major. Okay, this is your actual work. Good to mention in here, some of these courses are offered once a year. So let me tell you, for instance, clinical office and the medical office, they are offered only in fall. However, clinical 2 and medical 2, they are offered only in spring. And I think it makes sense. So it's kind of consecutive semesters. And I do highly recommend, please take them into consecutive semesters so you don't forget whatever you had before in the previous one. It will be very helpful. Many of my students, they are doing that. Some of them, they are just, they are having like lag. So instead of having them into consecutive semesters, they have like 2 or 3 semesters in between. So they completely forget what happened. Okay? Well, otherwise in here, they are offered both in fall and spring. And good to mention again, some of them, they are offered online, like Dynamics of Health, Medical Law and Ethics, Introduction to Psychology, Medical Terminology, they are all offered online. So it means that you can take one online and one in person, one lab. It will be perfect for you. And again, once again, I wanna, please go and see any of us or any of your advisors in order to help you to set up your schedule. Why? To save your time and to finish everything in the proper amount of time. All right. Now, what will be the total credit right now? It will be 60 credit you will earn once you're done with all of these courses. And this is the sequence in here. This how to take the courses, but we will work on it together in order to make sure that you are taking everything just before, because some of them they are changed, so we will share with you how to set up your schedule. Let's go next. All right. What about the externship? I told you once you're done, you will be graduating and you will start to have your externship. Again, externship, it will be through us, through the college, and we have a contract with several places. So it's not a big deal that you will find one of them, it will be the closest or closer to your residence. And you will feel comfortable going there, but don't forget that you need to spend like 15 hours on campus. So we will meet once a week just to have some seminar discussion about any of the cases that you have in the clinical sites. Or this is what I'm doing with the group right now. We are reviewing to prepare them to sit for the certification exam. So once they are done, they take the exam, be certified, take the externship, and ready to be hired. Is it good? I think yes. All right. Before having the externship, we have some requirements. What are they? Can we go next, Matt? Thank you. So prior to the externship, the medical assistant students, they need to have some steps. It's kind of a process, but it's not that complicated. So I will give you or the coordinator will give you in here the link to the corporate screening. So the corporate screening institution and immunotracks, they are responsible to make you the background check, the drug screening test, and to review all of your immunization record. Listen, you need to make sure that you have all the immunization you can see right now. It's not that easy to go to work with patients without being immune against certain diseases. And they will just guide you what kind of blood work to do and what are the blood titers that you need. And then they will recommend if you need a booster shot or no before starting your externship. Again, your safety is our goal. Well, what else? The CPR certification. What do you mean by CPR certification? So while you're taking the clinical courses, you will receive a kind of training for the basic life support and the cardiopulmonary resuscitation. So whenever you have any person stop breathing, stop the heart, stop working, so you start to help. But you need to be a certified personnel in order to be able to do that. And once after you're done with the training, you will have an exam based on that. You will have the certification. This certification, you will keep it till the end. So whenever you start your externship, you need to show them your proof or your card. This is very important. You will have the link to purchase this liability insurance. Is important, of course, yes. So suppose you're working on a patient, so drawing blood, do any other procedure, and then by mistake something happened. Who will be responsible? Who will be in charge? It's better to be the insurance company who will be in charge of you. So you have to pay like $35 and it will cover you throughout the whole year. Just you need to renew it once a year. And I encourage all of you to have this kind of insurance before starting our clinical 2 course. Why? Because, sorry, you will start to draw blood from each other. So it means that you have to be under coverage, you and your partner. Okay? So far, it's not that hard, but yeah, this is good. Let's go next slide. So these are the contact information This is the department. I have here, this is our Dean Serangelo, and this is her office. It's located in Bergen Avenue. This is her phone number, and this is her email, just in case if you need anything. And this is Dr. Sarhan Abdullah. He is our coordinator for the program. And these are the contact information, either the email or the phone, the office phone number. And this is me, Dr. Jihan Nakhla, and these are my contact information. And this is Miss Tess Wiggins, and she is the administrative assistant. So you can reach out to any of us. We will be willing to help you right away. I have one more slide. The next one, please. Yes. These are kind of frequently asked questions. This is based on my experience with the student, but at the end, of course, you will have the time to ask your question. So yes, how to set up my schedule. We said that we have some group at the beginning, kind of under general education, and the others for the major. And you will be able to either see the advisor or any of us in the department to assist you how to set up your schedule. When can I start my externship? Because this is commonly asked question. Can I start before I'm done with my courses? Of course not. You have to finish all of your major courses in order to start your externship. However, this question is very good. Can I have my certification exam done before the externship? Yes, you can. Once you graduated, you will be eligible to sit for the exam. And this is what I am doing right now with the group that we have. So we are preparing the students in order to sit for the exam before having their externship. Once they are done with both, they will be ready to go. This is very good. And now, can I switch from one major to another? Of course you can. And on the portal, you will have a form. You will be able to submit it. But under certain programs, you need to go back to the dean in order to discuss it with you. She has to, or he has to approve it, so you'll be able to switch. So can I switch from nursing to medical assistant, or the opposite from nursing, from medical assistant to nursing? Yes, but we recommend that you understand what you want to do, not to waste your time. That's it. So that's why we said fill up the form, submit it, and it has to be approved by the dean or the director of the program. So far, I think we covered everything related to the program. I hope that it helps. And as Matt said, yes, we will be with you at the end for your question. Thank you, Matthew. Thank you all.
Thank you very much, Dr. Nakhla. Very much appreciated. Very informative. I think I even learned some things today as you were going over some of the information. So definitely appreciate it. I'm just going to take just a brief minute, a minute to, a couple minutes here, just to go over some enrollment information to make sure that you have it and are clear if you haven't applied yet. What I have on the left-hand side of the screen is quick steps to enrollment at Hudson. Now, I put that up there just to kind of show you, the basic steps of you need to apply, you need to, take the placement test or be exempt from the placement test. If you're applying for scholarships or financial aid, you can view course schedules, meet with your advisor. Now, that is how everything was pre-pandemic. So I wanted you to see it just to see what the normal, quick steps to enrollment are. But things have changed with the pandemic. We are currently still not on campus, but we are working on to get many of our services, although limited, back in August. And we're gonna be following safety protocols and everything that goes along with that. And like I said, the goal is beginning of August. I don't have a set date yet, but so a lot of things everything can be done remotely. So anything you have normally been able to ever do on our campus, you can do remotely. So if you start with applying to Hudson, you can of course do that online at hcc.edu. And if you look at that first check mark there, I have a promo code on the screen that's capital H, capital C, and the number 3. That will waive the $25 application fee. So definitely take advantage of this now, because the promo code will only last so long. So definitely take advantage of it. Some of you may need to take the placement test. But things are remote right now, and we are giving students 3 options for placement. And I'm going to talk about that a little bit more on the next slide. But where you would go to is hccc.edu/remote placement. And there are exemptions from that as well. Again, I'll talk about that in a second. Once you have applied and you are either placed or exempt from placement, you can set up an appointment with a counselor or an advisor to register for classes. And there's a link there I have on the screen. It's a Calendly link. Some of you may have heard of that company before, but it's calendly.com/Hudson, CASS. And that is where if you go to that link, you will actually choose an appointment time to meet one-on-one with an advisor. But you have to complete your placement first, and you have to make sure you apply first. So don't set up an appointment with an advisor until you have done that. But that will be a one-on-one with the advisor, and it will be either your choice, telephone, or they will do a video conference with you as well. I also want to plug that our hcc.edu/coronavirus-resources. We are putting a lot of information on there about what's going on at Hudson, updates from our president, things we've already done, how classes are being run. So there's a lot of information on there that you can find. Just jumping to the next slide, I did want to talk briefly about the options you have for the college placement test. So on the left-hand side there, went too far. On the left-hand side there, you will see there's 3 options. You can be exempt from the college placement test by submitting qualifying high school transcripts, SATs, ACTs. Certain things will get you exempt from that. You can also take the online college placement test. That is now, we used to do that on campus, and we're hoping to bring that back in August. I'm not sure why this keeps jumping back and forth there. But the college placement test, we actually are working with a company called Examity, and you can take that class, take that test online through Examity. And it is actually proctored live, so somebody will watch you take the exam. And then lastly, we have directed self-placement. Directed self-placement is where you will actually review a questionnaire and descriptions followed by a brief, you will review course descriptions and expectations followed by a brief questionnaire. And at the end of it, you will actually make your own self-placement at the end of going through that questionnaire. You will do that in combination with the advisor. So the advisor will work with you on making that placement selection. Again, that's hcc.edu/remote placement. I also have the testing department's contact information, testing@hcc.edu, and their telephone number 201-360-4190. I do apologize that this keeps jumping. I'm not exactly sure why it keeps going back and forth. My hands are up here. I'm not touching anything. So I apologize that it's jumping back and forth there. I'm not exactly sure what's happening. But the one last thing before we get to the Q&A session at the end, if there's anything I can plug today, on the right-hand side here, the hcc.edu/enrollment guide. Everything you need to enroll at Hudson is in there. All new information about things we're doing with coronavirus and the pandemic, information about payment deadlines, how to register, remote services. Everything you need is in that enrollment guide. So if you're going to take one thing from me today about enrolling at Hudson, make sure you download or go to hcc.edu/enrollment guide, and it will download a PDF version of our enrollment guide. Lastly, on the screen here, I have our department contacts. So if you need to get in touch with admissions, financial aid, Bursar, which is the payments, paying your bill, and advisement as well. So that's where you would meet with the advisor. So definitely reach out to us. We have said it from the very beginning of this presentation. We're here to help you. So definitely feel free to reach out. We want to help you through the enrollment process. We want to help you get ready for the medical assisting program, whatever it may be. We are here to help. So with that being said, and since this keeps jumping around all over the place, let's get to questions. So what I'm actually going to do is stop sharing my screen here. All right, and give me just 1 second here. I can see that we do have some questions. All right. So the first question, Dr. Nakhla, I see is when you go for the information section, ask about, are you, I'm not, let me, so it says, when you go for the information section, ask about clinical experience. Are you going to be able to go to offices and have hands-on experience? So I think what they're asking, when you go to the clinical experience, are you going to be able to go to offices and have hands-on experience?
Yes, of course. So, and this is the main purpose of having these clinical courses. So, just let me tell you, for now, for the clinical courses, yes, we have the lab in person. And whenever we send you to the clinical sites, of course, you will have the chance to, but within the limit or within the scope of your profession. So within the scope of the medical assistant profession, you will be able to touch patient, do EKGs, the simple procedure that I mentioned. But for just to know from now, in order to draw blood, you need to be certified. So that's why this is the only thing. And for the medical records, so you will be able to participate in that once you start to be in the real job. So for now, you have the simulation, and in the clinical sites, they will let you to access, but in limit. And then once you are hired, you will have the training to, yes, of course.
Great. Uh, so does and I guess I can answer this question, but does financial aid cover this program? I'm sure you've had students go through the program or financial aid that they've worked with financial aid. So yes, from my understanding, this program, neither of us are necessarily financial aid experts. I can put that contact information back up for our financial aid department. But if you are eligible for financial aid, yes, students have gone through this program and have used financial aid to cover the costs.
Yeah.
All right. So next question says, what are some hands-on things you do in clinical program to be a medical assistant?
Okay, so just as I showed you in the slides, clinical, it means that you will be able to, number one, check the vital signs in the form of blood pressure, the pulse, the temperature, the breathing, the pulse oximeter. So you will be able to check the, so right now for the COVID-19, one of the landmark that this patient needs the admissions, this patient need ventilator, the peripheral oxygen. And this is very easy to be done with the pulse oximeter. You will see it in the clinical lab. Also, you will be able to do the AKGs. Yes, you will be able to do the AKGs, and this is that you will be providing your physician a good AKG in order to start treating the patient based on your AKG. So if it is clear, if it is good, it will be fine. And I prefer that my students, they are working on humans. Why? In order to be able to see what are the errors, what are the artifacts, and how can you handle it. So this is for EKG. You will be able to draw blood, and once again, if you are certified, but in the clinical lab, I will let you to draw blood. Yes, draw real blood. And also you'll be able to do the throat swab in order to be sent for culture. Maybe we need to, so for flu, we need to diagnose it. How? By these swabs. You will be able to do it. And you will be able to do the intramuscular injection, and certain places they allow the medical assistant to give shots for certain shots. Yes, you will be able to do it. Some urine examination, checking the blood sugar, all of these, and preparing the patient to be examined by the physician. So all of this, it will be your job. Sterilization, it's your job. So these are all hands-on.
Great. This question, and I may be able to take this one. It says, if I'm enrolled in a 4-year university and I'm taking credits for some of these courses, how would that work? So from our end on the enrollment side, what you could do is you could transfer to Hudson County Community College. You would have to provide your transcripts for evaluation. That actually goes to the email address is transfer evaluations, all one word, transfer evaluations at hccc.edu. Your documents would be evaluated to see what we would accept and apply for credit at Hudson County Community College. So we have students do that all the time. That transfer, not only transfer out of Hudson, but transfer from a four-year institution for whatever reason it may be, coming to Hudson County Community College. So absolutely possible, and we have a lot of students that do it.
Yeah. So all what you need, maybe that you need to provide them the course description that you had, so they will be able to evaluate it and give you the credits.
So it looks like we have somebody that is a sophomore next year, and I believe they're referring to maybe a high school. They said, how can I gain some experience in the medical field?
So I don't get the question right. So I don't know exactly what do you mean. So if you can just.
So if they, I think what they're trying to say is, how can I start building up my resume in the medical field? And, I actually used to work at a medical institution, and I know a lot of students used to do a lot of volunteer work at offices. That's probably your best bet. A lot of time offices are need the help. Now things could be different now during the pandemic, but I know a lot of students, especially when they were in high school, would volunteer at a medical office, and sometimes it's just filing paper, but at least you get the experience of being in the office setting and understanding what's going on. Usually if you call some local offices around your area and say, I'm a high school student, I'm trying to get some medical experience. Do you have any openings for me to volunteer there, or any assistance I can offer? That's what I have usually seen at the previous institution that I worked at. I don't know if you have anything to add to that, beyond what I mentioned, but that's from my experience.
So yes, I agree with you, Matt. But just to make it clear, so having medical experience is kind of a big term. So yes, you will be able to volunteer. So this is what, for instance, my daughter is doing. So she's volunteering somewhere like medical office, like medical centers. But again, as Matt said, yeah, you will be unable to touch patients, but you will be observing. You will have kind of experience the sense of the clinical field. So yeah.
Great. So this question is in regards to the pandemic. The student is saying that they are starting online because they believe the college is closed, and they wanted to know how our classes going to be run, especially lab classes that need to be face to face.
Well, this is a good question. So we are offering some remote classes. So the remote classes, you will be taking the lectures online, but remotely it means like this meeting virtually, we will do it. And usually it will be during the same time of the class. As for the clinical, we cannot do that. So we offer it in person in the actual lab, but with social distancing, with all the precautions that we need. So the face covering with the hand sanitizing and all of that. That's why we will be dividing, we will talk together once we start our labs. So we will be dividing the number of the students based on the lab capacity into groups, and each group will work hands-on, and then we will switch. So we have different protocols, but just to know that you will have the hands-on in the lab in person, but the lecture portion, it will be online. That's it.
Yeah, and about 85% of our classes this fall will end up being online. They're either going to be online or remote. And as Dr. Nakhla said, remote means that you still meet at the actual time. You will meet in a virtual Zoom or WebEx. Online means it's a fully online class. There's no set meeting time. It's kind of a self-paced kind of class. I do want to plug a link that might be very useful to get information about our return to campus, which is www.hccc.edu/return to campus. And it's all one word. So that's hcc.edu return to campus. We are posting a lot of information on there about our return, how classes are going to be run. So like I said, 85% will be online, but then there's about that 15%, which Dr. Nakhla was talking about, where we feel it's very important to get those students in person. We are going to be taking the highest precautions in regards to social distancing, wearing masks. After each class, things are going to be sanitized. So again, you can find a lot more information on the link, hcc.edu/return to campus. But we are following the highest protocols that the state is sending out, and we're doing everything, following the experts' advice. So we're trying to balance this right now during the pandemic, and as we all know, this is certainly challenging. But we feel this is right now during the situation, we're getting those high priority classes that need to be in person, and then everything else will remain remote or online. So next question. So the question was, my major was nursing, but I ended up changing to MA, which is great. And then she said, so I don't need to do the placement test. That's correct. If you were already in here at Hudson, you're already taking college level coursework and everything, you would not have to take the placement test. How do I make, here's the next question. How do I make my schedule with medical assisting on it?
So as I said, please come and see any of us in the division, or you have my contact information. I have many students, they contact me by email about their schedule, and each one is different. So I will recommend that you will talk to somebody in order to know what are the classes need to be taken, and then what is the next, which one is good to take it in person or remotely, which one you can take it online. So as Matthew said, self pace, yes, it will be up to your schedule, and we will be able to help you. I have many of my students, I could see some examples, to be honest. So they keep going back and forth. We don't know that this one has to come before this one. So yeah, they are wasting the time. So as I told you, we have some classes offered once in a year. That's why you need to talk to somebody to better assist you which one to take, and then what will be the next.
Great. And I don't know if this was mentioned in the program today, but what is the cost of the program?
Actually, so you can go to the financial department. It will help you better. But just I can say that the in order to to sit for the exam, it will be like for 155, the certification exam. In order to start your externship, you have to pay around 100 something, 150. But for the actual program, I guess, yeah, it will be good if you contact the financial department.
Yeah, so you can always contact the Bursar office, and I can put the contact information again. I'll put that on at the very end. I can let everyone know right now our president has made the decision to freeze our tuition, so tuition has not increased this year, which is absolutely wonderful. Our per credit at Hudson, it's $149 per credit. Which is significantly lower than what you're going to pay at, a four-year institution. So right now it's at 149 per credit. Most classes are 3 to 4 credits. So you'd be 149 times 3 or times 4. And like I said, I can put the Bursar information up again on the end if you do want to contact them for specific the specific cost of the program, and then maybe any additional fees. It said, next question, beside fall and spring classes, can you take any summer courses?
Yes, you can. So we have some summer courses in the form of mathematics. We have medical terminology. Sometimes we are offering in winter and summer the like medical law and ethics, like dynamics. So yeah, mostly they are the online classes.
Okay. This next question, I already select my classes for fall semester, but I don't know if I have to call to see how I will get those classes. I think what they're trying to say, it sounds like you might have an idea of what classes you want to take, but you haven't necessarily registered yet. I'm a little confused on the question, to be honest. But I think what you're saying, it sounds like to me you have selected the classes, but you don't know how to register for them. That would mainly be going through that link I sent before. You would have to set up an appointment with an advisor to set up your classes, and they can do that. And again, at the end of this presentation, I'll put some of this information back up on the screen for everyone to see. But I think that's what you're asking. I'm not exactly clear, so I apologize. You're welcome to rephrase that or put another question in if that wasn't clear.
Or you can email any of us if it is easy
Yeah.
for you. You can email any of us to clarify exactly what you mean by your question, and we will be able to answer you or to direct you to whom who will help.
Okay. Yeah, and that oh, so she said I registered for the campus, but I don't know if it will be offered on campus or remote. Gotcha. Okay. So if you want to, you can email one of us, and Dr. Nakhla can get in touch with me, because we can look up your schedule in the system. I would have to look you up in the system to see what your schedule is, but we would be able to tell you if your classes are remote. Like we said before, your classes are going to be remote or online. It's just your labs will be in person. So if you want to email one of us, that would be fine, and we'll be happy to look at your schedule in the system. Dr. Nakhla, if anyone reaches out to you about that, someone in admissions or enrollment can check that in the system.
So yeah, I received an email this morning about something like this, and I can say that, as Matthew said, most of the classes they are offered online or remote, except for labs. It will be offered in person. But again, you are more than welcome to email me anytime. I will respond.
Great. It says this question again, I'm not exactly sure. I think they're referring to clinicals, but it says you can study in any school or only the schools that you offer. So I think what they're saying is it I think what they're asking about is externships. Do you have to go to the ones that you guys assign them at?
So it's preferably yes. Why? Because number one, we have several units. We have several clinical sites. So we have the contract with them, and I don't say the authority, but I can talk with the supervisor to let you to switch from one or to rotate from one specialty to the other. And another thing that because my highest priority is you will get all the experience that I want you to get. And the second thing, because they are several, they are too many, so we will pick the one that it will be the nearest or the closest to your residence. So there is no doubt or no worry about how to go there, how easy it will be, but it's good. And you can talk to me or the Dr. Abdullah, the coordinator, about this to see if there is any other issue that we can help you with. But basically, yes, we have a contract with several clinical sites.
Great. I do see that. I think this is the last question I see. It says, are electronic health records used more now than paper records?
Yes, of course. So there is trend toward the EHR right now more than the paper. That's why I am enjoying teaching my students using the software, the simulation software, because it will prepare you. And let me tell you, one of the recruiter was hosting like a meeting or interview, and she recommended that all the students they do have this kind of skills to be working on the software. So yeah, EHR is a new trend right now.
Great. So I'm just going through. I think we got them all. If there's any last minute questions, it is almost 4:30. So I think we can start getting ready to wrap it up. What I'm going to do is I'm going to put back up on the screen. I'm going to put Dr. Nakhla and her department's contact information. So we'll say our goodbyes, and I'm going to leave that up for you. I'll also put up some of the enrollment advising, financial aid. I'll put that back up, and this I'll leave it up there for about a minute. I think somebody was asking for my contact information. I think I realized I didn't put it on the PowerPoint. My email address, again, my name is Matt Fessler, so the email address is mfessler@hcc.edu. Again, that's mfessler@hcc.edu. If for some reason you didn't get that, I'll have Dr. Nakhla's contact information up on the screen. And if there's anything that she needs, if there's anything admissions related or anything, she'll reach out to me and we'll make sure we get you, the information that you need. So with that being said, I'm gonna put that up on the screen, and I'll leave that up for the last minute, and then I'll close this out. Dr. Nakhla, thank you so much for being here and for presenting. Obviously, I could never have done it without you because you were the main part of the presentation, and you were just fantastic and very informative. So thank you for being here.
Thank you for having me, and thank you everybody for your time, and hopefully to see you soon.
Yes, we definitely want to see you at Hudson, and we want to help you. We know these are challenging times. There's a lot going on, with the pandemic and in the world. Reach out to us. We're here to help you. We're here to guide you. If you need to figure out everyone has different life things going on, has different situations. So if you need help figuring that out, give us a call. We'll show you a path of how it might be possible. Where there's a will, there is a way, as what they say, right? So once again, thank you all so much for being here. Have a great rest of your day. And again, I'll put up the contact information, but otherwise, take care. Thank you.
Bye, everybody. Take care.